Alright, so today we're doing liposuction, so I'm infiltrating tumescent solution which has epinephrine and pain medicine, and that's going to help keep the patient comfortable during and after the procedure and limiting how much blood we lose. And so we put this tumescent in through a tiny cannula. This allows us to get adequate pain control and provide epinephrine around the fat so we don't lose blood during the procedure. So after we infiltrate the tumescent solution, I use the vaser. The vaser just helps to break up the fat and it helps us get nicer, smoother contours. It's less traumatic fat removal for the patient. This vaser does not tighten skin, it just helps to release the fat from the surrounding tissues so that we get better contours during liposuction. Then once the vaser is done, we use this right here. It's a cannula to remove fat. It has tiny holes that pull the fat into our canister, and we use this machine right here. So as we do liposuction, you can see I'm removing fat and fluid, so some of the tumescent solution that I put in is now coming out, but now we have some nice yellow fat that's coming out as well. So when I do Lipo 400, I do the entire back here. So that is the upper back, the middle back, and the lower back. I don't like to put any incisions that are visible here on the back itself. Some patients will have what we call a buffalo hump, and that's just a collection of fat in the posterior neck. That area can be added on, but we often do this area to contour the neck and the back. So that's the buffalo hump. And we can remove fat from this area just like this. So how do I know when I have enough fat for a BBL? Or when do I stop doing the lipo? Well, I'm always going to do lipo the same. I'm going to do lipo 400. I'm going to be very aggressive in the upper, the lower, the abdomen, and the bra rolls. That's very standard. Depending on what the patient wants and their starting point, that will determine how much fat we need. I've done BBLs where I've only put in 200 cc's of fat each side, and I've gone as large as 2,000 cc's per side. On average, I would say it's closer to about 1,000 cc's on each butt cheek. I always like to overdo it by just a little bit, knowing that it's going to go down as the swelling goes away and everyone loses some fat. That's very normal. So if I get 2,000 cc's of fat, I'm pretty happy. If I get more than that, I'm ecstatic. So how do you know when you're done with the liposuction? I think it's more of a feel, it's more of a skill, it's your technique. So for me, I have a pinch thickness that I'm going for, and it's usually about 2 and so I know that once I've done that, I've still left a little bit of fat that's still going to preserve the blood supply to the skin without causing any skin healing issues. And so the deeper you go and the more superficial you go with the liposuction, the more risk of a complication. So you always want to leave a little bit of fat behind, but you also want to take enough to where you can really get a nice contour. All right, back in the OR doing an ultrasound guided BBL. I have a portable ultrasound device that transmits to this iPad here, and I'll just kind of show you what I'm seeing. So when I'm looking at the ultrasound, the skin is here. These little lobules, or this area here, is the fat, and here is the muscle. The purpose of using ultrasound is to avoid putting fat in the muscle, and we put it above the muscle in this layer right here where it's safe. When we put fat in the muscle, which we never do, you have a higher risk of fat embolism because there's large veins inside those muscles. So we always avoid the muscle and put the fat above it. And now we will transfer fat to the buttock. Primarily, she wanted just a little more fullness and projection and fill out some of those flat spots here. Didn't really want much hips, but you can see now she's got a lot more projection. You can kind of see that takeoff, that slope. That's that signature Dre sculpt slope there.